Now, of course, it wouldn't be healthcare without a few roadblocks, and certainly there have been some roadblocks. Notably, with you, you are involved in a lawsuit with one of your competitors, which you can't really talk much about. But you're also involved in a legal battle with the state of Texas, where your clinical operations are based. Texas, of course, last year tried to restrict the practice of telemedicine to situations where there's a pre-existing condition, where there's a pre-existing relationship with the patient.
Yeah,
And,
so that
and you have been fighting that. You did get a little bit of clarification that helped a little bit. Why don't you explain that a bit?
sure. So, 7 times now the courts have sided with Teladoc in our legal battle with the Texas Medical Board. We think it's very unfortunate that the Texas Medical Board continues to restrict the proliferation, or at least try to restrict the proliferation of telehealth. It really goes counter to the rest of the country. Just in the last, I think, 18 months, we've seen 15 or 16 different states, in 17 states now, enact regulation or legislation that's pro telehealth. So Texas is really going in the other direction.
Right.
They are this year, 2015. We had 2 more legal victories. The first of which was where the Texas Medical Board, the federal courts placed an injunction on the Texas Medical Board, preventing them from enacting regulation that would stymie telehealth. And then more recently, when the Texas Medical Board filed a motion to dismiss that case, our suit in federal court, the federal courts denied their motion to dismiss. So, the big thing there is that it's a very high bar in order to get an injunction, and the courts made it clear in their decision that they felt we have a very strong likelihood of success on the merits of the case. And so, we'll continue to fight on behalf of our members and our clients to make sure that they continue to have access to telehealth. Our suit in federal court is an antitrust suit, and it's based on a recent Supreme Court in February of 2015. There was a Supreme Court decision regarding the North Carolina Dental Board that's very similar, where you have a board that's staffed primarily by market participants, right? In this case, it's doctors, not dentists, and they're passing regulation that unfortunately limits competition, right? And that's
a guild.
Exactly. So that's the definition of anti-competitive behavior.
Yeah. Okay. And you're trying to innovate. You're trying to clearly, medicine as it's traditionally been practiced is just not working in the United States. I think everybody knows that, except for the people who are making lots of money off of it right now.
Well, I'm glad you said that, not me, but but you're exactly right. Yeah. It's it's a situation where we're improving access to care. We're increasing supply and therefore decreasing the cost of care. We're providing less expensive alternatives to high quality care, and really that should be good for everybody. Texas, just one quick statistics: Texas ranks 47th in the country in terms of primary care physicians per capita. So that's a state where you really need improved access to care. They could benefit among the most of any state. And so, quite frankly, that's part of the reason that employers and health plans in Texas and their consumers have really embraced the Teladoc platform.